I have John Snyder, president of Sanford Health Plan, joining me now from the 13th annual Becker's meeting in Chicago. John, thanks so much for being here.
Hi, Courtney. Good to see you again. Thanks for being here with me.
While you're there at the Becker's meeting, you're talking about how health insurers can better advocate for their members to influence health outcomes. Now, better health is really two-way communication, isn't it? What's the biggest opportunity for health plans in this area?
Yeah, that's a great question, Courtney. I think one of the most important things that I talked about a little bit today, and I've heard others talk about, is really member engagement. If you think about it, the only way to really improve health outcomes is by behavior change. And we can do all kinds of things to better care manage, but if we can't influence people's behavior, we're not going to be successful, and they're not going to be successful in their health outcomes. So how do we do that? We use all kinds of different new tools, I'll call them digital enablers, that really kind of help the member better manage their, whether it's a chronic disease or to stay healthy.
What digital enablers are we seeing that are helping members take control of their health?
There are so many out there, and it's a very much a new space. One of them is Labongo, and it, again, it's basically an app that helps people with diabetes manage their disease, and it helps them monitor their blood sugars, gives them helpful advices when things are out of whack. It prompts them through a coach, and then we found it very successful to improve outcomes. We're pulling all those levers again to try to influence those member behaviors.
Thanks, John. Now, what role does trust play in determining better health outcomes? And is this the value of an integrated health system like Sanford Health?
That's really true. If you think about it, unfortunately, health plans aren't necessarily highly rated by members or consumers. They're just not well thought of, and it's unfortunate. But when you look at us as Sanford, what is the one entity that a patient, a member really values, and it's that relationship with their doctor, and it's that relationship with the health system. And because we're part of that health system, it really gives us a leg up on that trust. Now we have to still earn it, and we have to maintain it, but it really gives us an opportunity for people to pay more attention to us. We share the same portal, for example. And so when they go into their Sanford portal, it's also the Sanford Health Plan portal. So it gives them all the confidence they have already in their provider, in their health plan. And it gives us that open door opportunity to influence their behaviors, whether we use that portal or whether we use those digital enablers I talked about.
Sounds like a lot of great conversations happening and a productive week over in Chicago. John Snyder, president of Sanford Health Plan, thanks so much for joining us.
Thank you, Courtney.
For Sanford Health News, I'm Courtney Collin.